Hi, everyone, and welcome to another exciting episode of the Conscious Counsel podcast with your host, Cory Sterling. That's me. I'm super excited to have a really wonderful guest here today. I've got Natasha Wilch with me, who's the founder of Concussion Nerds and who is the host of the Concussion Nerds podcast. Natasha, what's going on?
Oh, just here hanging out and working behind the scenes, but excited to chat today.
Yeah, I appreciate your time, and I'm super curious to ask you a lot of questions about your business and who you help and how you help them. First question, which I think is most obvious, is maybe you could just tell everyone a little bit about Concussion Nerds and why you started it, and why it's worthwhile for you to invest your time in this project, in this business.
Yeah, so Concussion Nerds is my clinical mentorship program. So I ultimately train clinicians, physical therapists, occupational therapists, athletic therapists, healthcare professionals, let's just say, that really want to be exceptional practitioners and working with complex concussion around the world. So for me, this started because I see clients that fly. I own a clinic in Nanaimo, BC as well. And clients fly from all over the world to our clinic to work with us in our concussion program. And when you do that, and when you have a podcast, and when you have a social media presence, you hear the shit over and over and over again. And so I was continuously hearing the stories of poor care or the gaslighting in the medical system or the difficulty. And really what that did was spark an interest of, I'm only one person and I can only help so many people. And we have epic results with our clinic. So if I could teach other clinicians in our methods and what we do to support concussion, then that ripple effect can help thousands and thousands of people. So that's what spurred the start of Concussion Nerds. And we have clinicians at this point in Canada, the US, New Zealand, Australia, and we're just continuing to grow. We have a really big mission ahead of us. So, yeah.
Very good. I'm really proud of you. I think what you're doing is amazing work and something that needs to get done. I'm going to jump into some of the things that you just spoke about, but before that, I think what's really cool is that you model your services to other healthcare practitioners or sort of holistic health professionals. Can you speak a little bit about how you generated that model? Because I think it's genius choosing a niche within that to train people up and give them expertise on one particular area that they can then apply to their own practices.
Yeah, I mean, I think what happens a lot with concussion is that people think it's just a bump to the head. And then, a few days later, everyone goes back to life. And that is not the way it goes. And so much of the training that's out there is a weekend course or a little thing to start to learn. And there's nothing that goes deeper. Nothing. And so for me personally, when I started seeing more concussion, you begin to realize it's not this adjunct service you can just add on to your repertoire of services, right? So a lot of physiotherapy clinics, for example, will be like, I do orthopedics, I do sport, and let's layer concussion on because it makes sense, or that piece of things. And you have to be somebody who actually wants to understand it because it is complex. And so what was happening is I live in little Nanaimo, BC. There's 90,000 people in our area. We have 7 clinicians. We are a concussion-specific niche clinic. People fly from all over the world. We're waitlist booked out for all clinicians. If we can make a specific clinic happen in Nanaimo, it can happen anywhere in the world. And the problem is that this diagnosis and this is happening more and more and more. We need clinicians who want to understand the depth of what this can do and how to help people with it. So in that element, instead of just teaching physical therapists business, or instead of just kind of supporting it, was this piece of someone needs to step in and create an environment where physical therapists can feel vulnerable to ask their questions because they're feeling lost. They need someone to have guidance. So it's not just this weekend course that you go to and then you're left to figure the stuff out on your own. And there needs to be a model that actually shows them what integrated care looks like and guides them through it and teaches them how to apply that to practice. So for me, it made so much sense just to really niche down into this persistent concussion space because it is so desperately needed around the world.
You started by saying when you have a platform and you're sort of an industry leader and you're on social media and you have a podcast that you really see, I believe the term that you used was all of the shit.
That is the scientific term I used.
Yeah, that's actually a legal word that we use, all the shit. Maybe you could just talk a little bit to someone who maybe isn't tuned into the conversation, where the disconnect is, and obviously I understand you're trying to clarify it, but where is that disconnect? What is all the shit that's happening out there that people don't know about?
Yeah, so I can answer this from two lenses. I can answer it from the patient lens, and then I can answer it from the clinician lens. So from the patient lens, the patients are feeling lost and they're feeling alone. So there is still a lot of, outdated concussion information that gets perpetuated in the modern medical system still. And so patients are being told that there's nothing they can do, or it's just anxiety, and they're feeling very lost and not knowing what to do. So from the patient side of things, there's that element of it. From the clinician side of things, the disconnect is, I think in PT school and in general physical therapy training, we're not trained to really look at something holistically. We all talk about how we do this holistic integrated practice, but I think that very few people actually treat that way. And so that disconnect is, a lot of it is, the clinicians get overwhelmed or get lost because we get these people in front of us. The human race is a very complicated thing right now. There's many factors. There's a lot of chronic illness. There's a lot of mental health. And then you start to layer these these elements on top of a concussion. And you have a client that sits in front of you that gives you a laundry list of things that are wrong. And the clinicians look at that and go, holy hell, what am I supposed to do? So this disconnect is, how do we actually take everything this person is saying to us and have a framework or a way of thinking that helps us break it into its components, but still look at the overarching care without feeling overwhelmed. And that's what I do.
Cool. Let's do it. So I would imagine, I've never seen a list. I've never treated anyone with a concussion, but I would assume that they would say they've got brain fog, they're tired, they feel anxious, they feel stressed, there's some part of memory loss, maybe their sleep is affected. Just off the top of my head, things that I would think would say. Cool. Yeah. I'm talking to you, Natasha. Where would someone start with that?
So you're going to start with an assessment in the clinic, and we're going to do what's called a multi-systems assessment, because those symptoms that you just listed can come from many different sources. So that is, with a concussion, there's 7 profiles of concussion, as in there's these 7 different systems can get impacted. And if all we do, this is the other thing that happens, if all we do is treat the symptom, you are potentially missing the root of what's driving it. So every single thing you just said could come from sleep. It could come from vestibular dysfunction. It could come from the autonomic dysfunction. So what we do is, when you come and you sit in front of us, we have a lot of technology in my clinic to basically help us see deeper. The human eye can only see so much. We do a true multi-systems assessment. So we're looking at, objectively, what does your autonomic nervous system look like? Your visual system, vestibular system, cervical spine, somatosensory system. We do some mental health screening. We're not mental health practitioners, but we do screening for mental health. And then we screen for your cognition. And then based on that assessment, we look at, okay, what's working really well? What's not working well? And then how are they talking together? I always say, are they playing nice in the sandbox? Because if they're not, that's what's going to give you that brain fog and that dizziness and the neck pain and all those pieces. And then from this piece too, we know that there's things that make it a higher risk for prolonged recovery. If there are mental health issues, if there are things like learning disabilities and ADHD, these are flags for longer recovery trajectories. So also, because we've done this full thing, what are we doing? What's our role? And then who can we pull in? And who do we need to pull in to collaborate with to ensure that our client is set up in the most awesome way for healing?
Perfect. It sounds like you've really got the formula down to a T, which is fantastic. So you just walked us through this process of, there's a variety of tests. We're going to look at different things. We're going to try to identify as many factors as possible. What is happening right now in a clinic where they're not applying your particular method? And as of today, what does the process look like, and how wrong is that process?
I wouldn't say the process is wrong. I would say it's incomplete. So a lot of clinics do, they don't screen everything. So they're missing what could be a driver to why someone's having a symptom. So they might be treating other things, but because they've missed this other piece, they're only going to be able to get so far. The other piece being, there's the depth of assessment that you can go. So they might be screening parts of a system, but they don't have the tools to go deeper to fully get the scope of what's actually happening into it. So I would say it's not necessarily, well, and then I will say there's one thing that's being done wrong a lot, but it's not necessarily the wrong, it's that it's incomplete. Parts that are significant to concussion recovery are being missed over and over and over again. So then what happens is the client gets rehab, they get a little bit better, but then they get stuck and they plateau. And then because that clinician has exhausted they've reached this clinician's ceiling, this clinician doesn't know what to do anymore. So ideally that person refers out to someone else, but that's not always happening. And then the person gets told they have to learn how to live with their new normal. The other piece is when we look at this nervous system, the whole aspect of the nervous system regulation element, and I do think social media does it a disservice. We're not supposed to be calm human beings 24/7. That's like the goal of our nervous system is to dynamically respond to the stimulus in an appropriate fashion. So it should be more flexible, more dynamic. But with concussion, there's almost always an element of nervous system dysregulation, and clinicians don't know how to work with that. And so for us, the model of what we teach is the nervous system is the foundation. So how do we work in a nervous system aligned way to get better change faster as well?
Beautiful. Helpful for anyone who's listening. I'm sure they're going to get it. When you started, I guess even when you started your own clinic, did you have intentions to become global? Did you have intentions to have clients fly all over the world to see you? How did that piece of the puzzle fall into place?
I didn't even plan to treat concussion. I didn't when I opened my clinic. So I've had Symphony now for 11 years. And when I opened it, I did stroke, Parkinson's, and MS. And spinal cord. That's what made up the clinic. And then I remember there was an occupational therapist who referred me a persistent concussion client. And I remember this person comes into my clinic, she sits in front of me, and I just looked at her and I said, I'll be honest, I have no idea what to do. A concussion is not a stroke. And I just looked at her and I said, if you're willing to work with me, I'm willing to learn. And I always say, thank God she never left, because who knows what would have happened. And I just think she stayed because there was nowhere else to go. But I literally enrolled in my first course 2 days later, and I've never looked back. And I do think what happened is my dad had a brain injury when I was 17. And it completely disrupted our family, and definitely threw some curveballs in my own life. And so I think with having someone else in front of me who started sharing things about her life, how her life was impacted, and it brought up these old feelings and like memories of, oh crap, that happened to us. And this is 21 years later and it's still happening. It kind of lit that fire under me to be like, this needs to change. And that's what kind of started into me actually stepping into social media and being more present on social media. Never in my life would I have thought that I had clients flying from around the world to come work with me. We have clients this year coming from South Africa, from the Netherlands, from Spain, from Australia, and then Canada and the US. Like that, it humbles me every time it happens, and I don't take it for granted. And the flip of it is, and why a piece of Nerds exists, is they shouldn't have to. They shouldn't have to fly across the world to receive what they feel like is exceptional care to help them heal.
Yeah, I hear you, and I think that the two things I love about your story is that, one, it's like stepping into the unknown, and just the situation arises where the person comes in and you say, hey, let's do this together, and it ends up being able to support so many people around the world. And secondly, you're on a mission to make the change that you believe in. So I know that you're affecting so many people positively. How do you have certification programs? How exactly does it work if there's a practitioner, a PT or a chiro or someone who's listening who's interested? How does the process work?
Yeah, so our doors are actually going to open again in the fall. So the Concussion Nerds Fellowship is our 6-month mentorship program. I am in the process of I just did a massive update. I'm refilming the whole program. I've streamlined a few things within it after. But someone comes in and they go through the fellowship. After the fellowship, you have the opportunity to be invited to be part of what we call our Nerds Network directory, which means we're also launching a new Concussion Nerds specific website in the next few weeks as well. And so basically you get put on that directory so that anyone around the world can find you. We get people who reach out regularly asking if we have nerds in different states, in different countries, in different towns and cities. And so if I can connect people to help, that is my goal. Like, it should be easily accessible and they should be able to find them. So if someone comes through the program, they do the 6 months, we have options to stay as we call it a lifetime nerd. So we have people who've been in the community for 3 years. They still show up to every call and have for 3 years because of the value they get in the mentorship from the program. And then the directory piece. So there's not actually so at the moment, there isn't like CEU accreditation with the program. That's a whole other process for us to potentially go through. But the term, like if you call yourself a concussion nerd, that is a trademark term. And so that branding is protected by us. So we can build a community of true concussion nerds, which then we know represents the training they've gone through to practice in this way.
Yeah, that's wonderful, and I'm sure that there will be people reaching out. Also, as an intellectual property lawyer, I'm very happy to hear that you have Concussion Nerds trademarked. I'm curious, did you trademark making the invisible visible as well?
I didn't trademark that. I feel like that term gets used. I mean, I don't think I created it, but I don't remember seeing it before. But it gets used everywhere. I don't even know if I could trademark it. I should probably look into it.
You could. The answer is that you could, especially for the scopes of service. That's a whole other conversation. Sort of just as we wrap up here, firstly, like, super cool, Natasha. I want to thank you for your time and also for what you're doing. Like, there's no question you're making the world a healthier place, and you're helping people who are in need. Unequivocally, they need more support, so you're helping to provide that. Maybe you could just talk a little bit about the entrepreneurial journey, being an entrepreneur in health and wellness, and obviously with such growth and such plans, are you constantly studying? Do you have business coaches? Are you just figuring it out as you go? Do you have mentors? I'm just curious for your mindset on being a business owner and operator.
Yeah, so I have business coaches. I've had different ones throughout the years. I've had different mentors, colleagues who we kind of bounce things off of. I've never done business school, so very few of us actually have the entrepreneurship world. And when I started my physio clinic, you don't learn anything business-wise when you're in physiotherapy school. And so when I started my clinic, it was really off of, what past experience. I worked in offices. I've done bookkeeping. I was an administrator before in different jobs. So I was literally pulling on my life experience up to that point to start this business, but also knew, I think when we start a business, I'm very much like, what is the plan? Like, what is the direction this wants to, is this a business or is this a hobby? And so for me, with the clinic starting with and knowing the direction I wanted to go, I invested in the right legal steps and had a lawyer and the bookkeeping and the accounting and the branding from day one before I had a single client, because I needed to set myself up for success so I could just step into that and keep going. There was from the clinic perspective, 2020, 21. So really 2021, 2022 I almost lost the clinic. I almost lost it. And not because we didn't have clients. We had a 6-month wait list for our services, but because with the social distancing parameters, with staffing issues, we couldn't get enough clients in. Concussion then was still a relatively newer area, and it was difficult to find clinicians who wanted to niche and have that be their primary caseload. From a concussion nerd side of things, when I started that, same thing. I knew where I wanted the program to go. And so many people are just say, just do it or teach off the thing. And aesthetically, I wanted something that was branded, that could stand out, that could be recognized and move forward. But it's been a whole journey. Business coaches, mentors, community, and my own community has been amazing, and such a necessary piece of this. And honestly, it feels like I'm just about to board the rocket ship and the sky's the limit.
Cool. I believe it. Your potential is unlimited, and it is a fun feeling. Even though you've been doing it for so long, still that feeling of it's just getting going. We're actually just starting, even though so much has already happened. So, Natasha, that's amazing. I want to thank you. I really appreciate and value this conversation. For anyone who's listening, where could they reach out to you or learn more?
Yeah, so the easiest place is my Instagram, so it's just at natasha.wilch. I am the only one in my DMs. Feel free to send a message. I connect with everyone. And if you love the topic of concussion, the podcast, so the Concussion Nerds podcast, we have 100 and some odd episodes at this point. There's a slew of information on there as well.
Cool. Way to go, Natasha. You're the best. Thanks so much.
Thank you.